Welcome to the insertion and removal section. In this section we'll learn how to safely insert and remove an RGP lens from our patient's eyes. So to insert an RGP lens onto a patient's eye, first of all we place a wetted lens onto your index finger. Using either your thumb or the index finger of the other hand, hold the eyelid up underneath the eyelashes fairly firmly against the patient's eyebrow bone. With the middle finger of the other hand, lower the lower eyelid so that we've got a nice wide gap, and then gently place the lens onto the centre of the cornea. Release first the lower lid, then ask the patient to look down and release the upper lid. If the patient finds it particularly difficult, then it's okay for us to use some anaesthetic to reduce the initial reflex tearing and to make the lens insertion slightly easier. This is not something that we can do on a regular basis with patients, but for the fitting process, there's no harm in doing it at all. Once the lens is on and we've repeated it with the other eye, the patient needs to go and sit in the waiting area for a good 20 or 30 minutes to allow for this reflex tearing to eliminate. If we try and assess the fit of a lens in a patient's eye that's tearing excessively, we'll get a very false reading of what the lens is doing. It will invariably be highly mobile, and we'll consider that to be a flat fit. So by waiting 20 or 30 minutes, we get a much more stable, accurate assessment of the fit. For lens removal, what we would normally do is get our patient to look straight ahead at eye level or possibly slightly above eye level, perhaps looking at a letter on the test chart. Place our index finger on the lower eyelid and pull down gently. Place the index finger of the other hand onto the upper eyelid. Pull the upper eyelid up gently. Ensuring that the aperture between the two lids is wider than the diameter of the lens, we then bring the lids slowly together without rolling the lids out, as this causes the lens to slide underneath the upper or lower eyelid. So keeping the margins aligned with the surface of the eye, bring it slowly together until we can feel the edge of the lens. And then just bring it gently together, and either the top or the lower edge of the lens will gently lift off. Bring the lids closely together and you'll find the lens sitting on the patient's eyelashes. With the patient's eye still closed, lift the lens off and the patient can now reopen their eyes.